Thank you, Mr. President. I'm not supportive of the bill that we'll be voting on shortly relative to the labeling of GMOs, but I do admit that the senator is right in that this was an example of a group of Democrats and Republicans working on a solution that may end up getting the support of the supermajority of this body. And that, of course, is the difference between what happened on the process of developing a GMO bill and the process of developing our response to the Zika epidemic. I mean, everybody knows what happened here. We had a bipartisan compromise that passed the Senate. It went to a conference committee. Democrats were shut out of the conference committee. I'm a member of that conference committee. There was no negotiation between Republicans and Democrats. Republicans on the conference committee threw out the bipartisan compromise that was negotiated here in the Senate in order to address the concerns of very conservative members of the House Republican caucus. And the bill got loaded up with all of the things that Senator Durbin mentioned at the top of the list, a ban on funding for Planned Parenthood, which Republicans on the conference committee knew would poison the well. They knew by putting in a ban on funding for Planned Parenthood that they would make it impossible to pass the Zika supplemental request. We don't need to engage in hyperbole or histrionics. That's just what happened. What happened is that the Republicans decided to put a bill on the floor of the Senate that couldn't pass, knowing exactly what could pass because just weeks earlier we had formed a compromise that was thrown out the window. And so, it's a little unpleasant to be lectured to about why Democrats are unwilling to support the Zika bill that's in front of us, because Republicans know exactly why we can't support it, because the compromise that we all worked on got thrown out and all sorts of political poison pills got added to it that everyone in the conference knew would mean that it wouldn't pass the Senate. Mr. President, I wanted to come down to talk about, frankly, another public health crisis that is confronting this country. And that's the overdose crisis that is, frankly, plaguing every single state that we hail from. Here's the picture of overdoses in my state over the course of the last 4 years. And it is a harrowing chart in that if you go back to 2012, we had just under 400 drug overdose deaths that year, and we are on pace in 2016 to more than double that number. Our projected number of overdose deaths is 832. And if you look deeper into this chart, it's really fentanyl and heroin that are driving these numbers. In fact, our cocaine overdoses have remained relatively stable. It is fentanyl and heroin that are skyrocketing. And you could put this chart up for almost every other state in the country and see the same phenomenon. And here it is broken down by town. You can see that there's almost no town in Connecticut that hasn't been visited by this epidemic. This small little town down here is one that you probably know. That's New Haven, Connecticut. And on June 23rd, just a few weeks ago, city officials in New Haven declared a public health emergency when, after 17 individuals overdosed and 3 people died from fentanyl in less than 24 hours. Some of the patients needed as many as 5 doses of Narcan to revive them, and public health and law enforcement in the city effectively ran out of Narcan overnight because of this batch of straight, pure fentanyl that killed 3 people and sent 17 others to the hospital. That's just one night in one town. 2 years ago, the United States Congress authorized $4 billion in emergency funding to combat the Ebola virus. $4 billion for a virus that had less than 10 confirmed cases in the United States. In Connecticut, we are going to have 830 people die from opioid overdoses this year. We're a small state. We represent 1% of the nation's population. We're going to have 830 people die from overdoses this year, and this Congress hasn't appropriated one dime of emergency funding. And you can't help but think that there is a double standard here. that perhaps the reason that we are not allocating emergency funding for this epidemic, which is killing dozens of people every week in my state, is because of the nature of the epidemic, that it's rooted in addiction, and that we still have a stigma about addiction in which we blame the addict. Well, Marvin and Laura Benenson came into my office, and they told me the story of their beautiful, bright young daughter, Victoria, who began slurring her words at the Easter dinner table. Victoria was a wonderful young woman, but they knew something was wrong that Easter. And so when she left the house, they went into her room, and they found needles and little packets of a substance, and they say, "Thus began our battle with heroin addiction." This is the father talking now. He said, "My daughter has now been through detox and 6 treatment centers. She's stolen and hocked all of my wife's jewelry while we were on vacation. She's stolen $3,000 to $4,000 from my oldest daughter's bank account while she was in the Army. She's written thousands of dollars of bad checks from her friend's checkbook, and she's been arrested for shoplifting." The truth is that addiction is a disease, just like cancer, and there's no choice once you have it. It certainly was our daughter's choice to take heroin, but it wasn't her choice to become addicted. Addiction is a disease, and it can be treated medically just like every other disease. There may be an element of choice in taking that first dose, but after that, there is a medical solution. And yet, for some reason, we allocate $4 billion to combat Ebola and not a dime to combat the epidemic of opioid abuse. The funding that we're asking for, and Senator Shaheen, my colleague, put a vote before this body to appropriate $600 million in emergency funding, would go to SAMHSA for treatment. It would go to education programs, to prescription drug monitoring programs. $230 million of it actually would go to justice assistance grants to make sure that we're catching the bad guys who are selling this kind of fentanyl that's killing people in New Haven. And every day that we wait, this epidemic becomes worse and more people perish. We need to come together and appropriate emergency funding to take on this epidemic. And we need to do it soon. But we need to do other things as well. Deep buried into our Medicaid reimbursement laws is a discriminatory prohibition on Medicaid funding being used for long-term substance abuse and mental health treatment beds. Now, the presiding officer and I are trying to repeal this provision as it relates to the treatment of people with mental illness, but it also relates to people who are struggling with substance abuse. Medicaid dollars cannot be used for long-term treatment beds for individuals with substance abuse and mental illness. It's really the only instance, one of the few instances in our reimbursement policy at the federal level in which we specifically prohibit reimbursement for a treatment that has been prescribed by a medical professional. And again, this seems rooted in this decades-old stigma about people with mental illness and substance abuse, that they should just get over it, that they should just cure themselves, that they should just make a different choice. And so there's not a need for these long-term beds. Well, the second thing we need to do is, in addition to appropriating emergency funding to take care of this immediate crisis, repeal the prohibition on Medicaid dollars going to long-term treatment beds. Not everybody needs long-term treatment, but many do. Many are comorbid with a substance abuse disorder and a mental illness. And yet you get kicked out of many treatment centers within a handful of days. This is a discriminatory provision in our law, and it is leading in part to this epidemic because once they show up in the emergency room, there's no place to put them. And third, we need to build on what the administration announced recently and pass something called the TREAT Act. The TREAT Act would allow for more patients to get prescription naloxone, buprenorphine, for treatment of their addiction. Buprenorphine is an effective drug, but right now, doctors can only see a relative handful of patients before they hit a statutory cap. We have examples in Connecticut of individuals traveling on 12 buses for 12 hours to find a prescriber who still had room under the cap in order to prescribe buprenorphine. The lengths that you have to go to get medical treatment for addiction are more evidence of this discriminatory treatment and this stigma that remains in the law. There is no cap when it comes to the number of patients that a cancer doctor can have or an orthopedic surgeon can have, but there's a cap on the number of patients that addiction doctors can have. We've got to pass the TREAT Act as well. Mr. President, these addictions can be treated. I sat down with a group of former heroin users, individuals in recovery, in Bristol, Connecticut, back in March. I spent an entire day in March living a day in the life of the epidemic, visiting emergency rooms, first responders, and people in recovery. And Greg told me this story about injuring his back in his line of work, which is being an arborist. He's outdoors, he's working with trees. He injured his back, and he got prescribed prescription painkillers for his herniated disc. And you know this story. He got hooked on those prescription painkillers, and he found as many doctors that could continue writing him scripts as possible until he ran out. And then he finally, when he couldn't find any more prescription drugs, turned to heroin, and he became an addict. He looked and looked and looked for treatment, but couldn't find it. And finally, he ran into Courtney Labonte, who runs a website called ctsuboxone.com, and she found him a treatment provider who could get him on medication therapy. And today, he is in recovery. He is doing better. He has made the decision to change his life, but he has the resources to do it. And there are millions of people who can tell that story as well, but not enough. Because without this funding, without the repeal of this discriminatory Medicaid rule, without the passage of the TREAT Act, we are denying medical treatment to the thousands of people in my state who are grappling with addiction, and this year, the 800 who will die of overdose. So I would hope that before we break, we will find the courage and the common sense to pass these measures, at least to get some emergency funding appropriated. I thank the body for the time, and I'd just like to make a UC request. I have a fellow who's worked on this issue, Dave Keehee, and I'd ask that he be granted floor privileges for the remainder of the calendar year.
Without objection.
I yield the floor.